You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, menopause. My first guest is an expert on the topic, Dr. Andrea Cole. Dr. Cole, welcome to the program.
Oh, nice to be here, Randy.
Now, and I know this is a big topic, but
is.
what's changed since, I guess I first met you, had you on the show probably 7-8 years ago.
That's right.
What's changed? I mean, do you look at it from a different perspective than you did back then?
Yes,
and if so, how so?
I do. It's a much bigger perspective. So for me, it's been quite a journey. It's like peeling an onion. So first I balanced the hormones, but that didn't give me the answer to the clinical picture. And then I looked at all the biochemistry. Right. And now we're looking at a number of different things, neurotransmitters. And really the big thing now is the connectiveness of everything. So the neurologic system and the immune system and the endocrine system, it's not separate like we were all taught in medical school, but they're so intertwined. And so what may present as an endocrine problem may have as its base an immune problem.
What about results? I mean, are you able to get better results than you could back then? I mean, relieve women of their symptoms, men of their symptoms?
Yes, and for example, I had a woman who presented in menopause with a lot of depression. So we balanced the hormones, the estrogen level's fine, but her brain doesn't work. So when
brain doesn't work, meaning what? What does that mean?
She can't think. She's crying. I always say, if you're crying at commercials, you've got to come see me. It's time to adjust the hormones. Okay. But she's doing that. She's weeping. She's crying. She's driving down the street. She's crying. She's crying. She's crying.
Interesting.
So weepy, weepy, weepy. So we looked at her neurotransmitters, and her serotonin levels were very low. And if I can balance that, I can use a much lower estrogen dose in her, and she will do better. Okay.
Now, you explained that. This menopause. We were in the green room, and you were saying that women come, and I said, well, what does it mean to be in the menopause? I mean, what are women going through?
So I'm beginning to look at menopause a little differently. It's not just biochemical, but it's really about what do I want to create for the next 50 years. And some women it's like you're given a second chance. You
second half of life. Okay.
Second half of life. So maybe there's a loss. Maybe they're not where they thought they would be at this stage in their life. And they almost have to process this because it will bubble up in menopause. So any unresolved conflict or issues that you didn't take care of back in your early years, it's going to represent in the menopausal years.